Hello and welcome. Today I'll be speaking to you on medications that are associated with gout. I've made a video previously on gout, and that video is titled "Doctor, is this gout?" I encourage you to watch that video before watching this, or after watching this, you could watch that video. So today we're looking at medications. There are a number of medications that are prescribed for different reasons, but the side effect could be presentation with gout. And just for a quick recap, gout is a form of arthritis that presents with joint pain and swelling, particularly involving the big toe. And then sometimes could also affect other joints, say the ankle, the knee, or some other joints in the body. But essentially what's going on is the fact that you have raised level of uric acid in circulation called hyperuricemia, and these crystals deposit in joints causing inflammation. So these medications include, number one, diuretics. These are sometimes referred to as water pills, and they could be prescribed for a number of reasons, either for patients that have heart failure or high blood pressure. And categorically, we talk about loop diuretics, thiazide diuretics, and these medications include furosemide, hydrochlorothiazide, benroflumethiazide. These medications are given for other reasons, but the side effect could be hyperuricemia presenting with gout. Number two, aspirin. Aspirin can be prescribed for heart health or prevention of stroke. As important and as vital as this medication is, the problem is that sometimes may also result in raised uric acid level and present with gout. So aspirin, low dose aspirin particularly, is a good medication but could present with hyperuricemia or gout. Number three, immunosuppressants. Immunosuppressants can be prescribed in patients that have had an organ transplant to prevent rejection. And such medications will include cyclosporine, tacrolimus. These medications can present with hyperuricemia and gout. Number four, niacin. Niacin is vitamin B3. I've made a video on vitamins, vital amines. You could watch that video as well. So vitamins are very good. People take them as supplements, but the problem is that sometimes we don't realize that these supplements can also present with problems. Niacin is B3, vitamin B3, used in high doses can present with hyperuricemia and gout. And then we'll talk about other agents such as chemotherapy for cancers. The problem with these medications is that they cause rapid breakdown of cells, and by so doing could present with hyperuricemia and gout. Other medications include levodopa, used for Parkinson's disease. Beta blockers are medications that could be used for treating high blood pressure, palpitations, but they could also present or trigger gout. ACE inhibitors can be used for treating high blood pressure, but could also present with gout. Testosterone can be used in treatment of hypogonadism. One of the problems could be gout. And then two medications that I'm going to mention that are used in treatment of tuberculosis. These medications are, number one, pyrazinamide, number two, ethambutol. These medications are used, but the problem is that they could also present with hyperuricemia and gout. So I've made a list of medications that are used for different purposes but could present with gout. I'd encourage you to watch the video on Doctor, is this gout? And if you have learned something, like, subscribe, and share. Thank you. Bye.